السلام عليكم.
وعليكم السلام.
وعليكم السلام دكتور.
How are you guys?
Fine, thank you.
الحمد لله يا دكتور هاني.
How are you?
Yes, fine. Okay, today inshallah we will start the practice for some stations for history taking, Odebara, special stations like travel history, whatever, diarrhea or fever, sexual history, whatever symptomatic or asymptomatic. It could be, I'm talking about asymptomatic, it could be low risk or high risk. Some special stations for bleeding. The most common in the exam for bleeding, upper GI bleeds and vaginal bleeding. Hematuria also sometimes. We have for practice today Emmanuel, Naglat, Gad, Ahmed, Khalid, Ali, Omar, Javina, Basamat, Naglat Faki, and Kalia. If anyone interested to practice, please raise your hand. Practice is very important for you guys, especially with me, because I will give you fair feedback. Just to remind you, for new members, you have 4 stations in the exam for history. Number 1, 2, 3, and number 10, complex stable patient. It could be adult, history taking, or pediatric, or psychiatry, or toxicology. For Hyderabad, face-to-face complete now. You have 5 domains: accuracy, skillfulness, efficiency, structure, supportiveness, safety. So if you follow these 5 domains, for sure you will get 10 out of 10. Accuracy, checklist. We are providing you general approach for each category. Skillfulness, you should be fluent. Efficiency, structure, you should be organized. Supportiveness, your attitude inside the room. It means a good eye contact, good body language, check comfortability, check pain, check symptoms before proceed, and empathy, sympathy, rapport, give information in pieces, questions in pieces, pause between pieces, check understanding, safety, correct information, correct differential diagnosis, correct decisions. The general approach of history, you have part 1 and part 2. Part 1, introduction, good morning, and blah, blah, blah. May I know your name and age, please? Nice to meet you, smile. Then you have 3 open questions, 2 in the beginning and 1 in the end. The first one, how can I help you? Stop. Don't follow open question by closed question. So open questions, it means open questions. How can I help you? Stop. Oh, sorry to hear that. Show sadness. Today we will follow Odebara. So you will ask, are you comfortable? Do you have any pain? Do you still have blah, blah, blah? For example, the patient has bleeding. So are you comfortable? Do you have any pain? Do you still have bleeding now? Like that, okay? Because if the patient has bleeding, you have to control the bleeding. If he said, yes, I still have bleeding, you can say, I will move you to observation room and control the bleeding first. Then I will need to take some data. So you will take consent. Then the second open question, can you tell me more about that? Then repeat what he can say. If the patient said 1 sentence, repeat that. 2 sentence, repeat that. 3 sentence, repeat that. Then start Odebara and then review of systems. Review of systems, it depends on the most relevant system. Okay. So if the patient has headache, start by head and neck, then musculoskeletal, so sinus and then musculoskeletal, then other systems. If the patient has problem in the chest, so start by cardiovascular respiratory, then other systems. If the patient has problem in the tummy, start by GIT, urogenital, ministerial if female, and then other systems. Then you will go for part two. Any past medical disease, stop. Any previous surgery, stop. Any prescribed medicine, stop. Any allergy, stop. Any disease run in your family, stop. And then social history, 3 questions. No need to ask about sexual history or travel history. You will ask only about sexual history if the patient has complaint of dysuria or urethral discharge. You will ask about travel history only if the patient has fever or diarrhea. Then the last open question, would you like to add anything else? Then concern, what is your concern? Then diagnosis and management plan. If you feel you are confident about the diagnosis mentioned, according to your data, the most likely problem is blah blah blah. If something serious, mention. If something benign, mention. So you will mention organ, for example, the most likely problem in the heart or in the brain or whatever. And if you find the problem is serious, you can say it's serious. If you find the problem is benign, mention it could be benign. If you are not sure serious or benign, no need to talk about serious or benign. Then management plan. Management plan, you have 4 or 5 management plan for all history taking. So for example, you have history taking in real practice or in the exam, more than 70 stations. You have only 4 or 5 management plan. Okay. So if the complaint relevant to the chest, give the management plan this one. If the complaint relevant to the head, back, and limbs, give this management plan. If the complaint relevant to tummy, relevant to liver, spleen, gallbladder, give this management plan. If the complaint relevant to urogenital, tummy, kidney, ureter, or bladder, give this management plan. Socrates, we finished already, and then review of systems. Odibara, we practiced 2 sessions, and today also we will practice Odibara, same. So when did it start, sudden or gradual? How long has it been? Is it affecting daily life? Is it worsening, improving, or same? Is it continuous or on and off? Have you had this problem before? Anything cause or worsen it? Anything improve it? Then review of systems. Start by the most relevant system. It depends on the company. Who approach will practice next time, inshallah. So today's stations, travel history. It could be diarrhea, it could be fever. So you will follow travel history. 4 questions. You will ask about where, when, or when, where. It's up to you. You can start by anything. Then activity, then prophylaxis. 4 questions again. When, where, activities, prophylaxis. You can ask these questions after review of systems, or you can ask after Odibar. It's up to you. No problem. Don't worry. Sexual history, you have 4 Bs. You can ask them after Odibara or after associated symptoms, no problem. In sexual history, do you need to ask all review of systems? No. Genitourinary, more than enough, and GIT. Okay. Amenorrhea, do you need to ask about Odibara? No need. You can jump to associated symptoms. So you can start by ministerial, then genitourinary, then GIT. Okay. Regarding bleeding, you can ask about questions of bleeding in Odibara. In which point, guys?
Intensity.
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 I. Okay. So you will ask all questions of bleeding in I. So you will finish O, D, then I. You can ask questions of bleeding. For example, how often is it before, during, or after? What is the color? Is it fresh red blood or brown? Any clots? How many pads? How much teaspoon or cup? Any bleeding from other orifice? So some questions are not applicable. No problem. You can ask, for example, the R7, you can ask at least 3 or 4 questions. Not mandatory to ask all questions, guys, in any station. Okay, we will start now, Emmanuel. Emmanuel?
Yes, sir.
Yes, how are you?
I'm doing good, sir. How are you, sir?
Fine. Okay, so this patient has fever and already mentioned arrived from Malaysia last night. Okay, so you will follow travel history. You will ask about travel history, the 4 questions. It means the when. You can ask when did you travel, when did you return, and where did you travel, where did you stay? Can you tell me more about your activities there? Did you receive any immunization? So 4 important questions, okay? Sometimes the actor, when you ask him open question, can you tell me more about your activities there? So he can say, I did blah, 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 blah. What if the actor did not give you information and you want to ask him special questions in activities? For example, did you visit mountains? Did you get any mosquito bite? Did you use any mosquito net? Any sexual activities there? Did you get my point?
You got it, sir. Yes, sir.
Okay. So you will follow part 1, then Odibara, then associated symptoms, then travel history, then part 2, then diagnosis, then management plan. Regarding the most relevant system in review of system, favor, what is the most relevant system here?
Systemic involvement, sir.
All review of system, right?
Yes, sir.
All important. But which is important for us as physicians? CNS, right?
Yes, sir.
CNS. So the patient can die from CNS. So you can start by CNS, then musculoskeletal, then cardiovascular respiratory, okay,
Yes, sir.
then GIT urogenital, and so on. Okay, so you can start.
Can I start, sir?
Okay, you can start.
Good morning. I am Dr. Emmanuel. I am one of the ID registrars. May I know your name and age, please?
I'm Khalid, I'm 23.
Nice to meet you, Mr. Khalid. How can I help you?
Yeah, I have temperature, doctor.
Oh, I'm so sorry to hear that. Are you comfortable right now?
The nurse gave me paracetamol.
Okay. Do you have any pain? Okay. I would like to know more about your fever. Can you please tell me about your fever?
Yes, I have temperature started 3 weeks ago, started gradual, increasing, worsening, and I think it's on and off.
Okay. Okay, Mr. Khalid, you said your fever started 3 weeks ago and it was continuous, sudden and gradually it is increasing. Is that right?
No, I said started gradual, on and off, worsening,
Okay, you said your fever started 3 weeks ago, gradual and worsening. Is that right?
and on and off.
Yeah, and it is on and off. Okay. Uh, I would like to ask you a few more questions to understand what's going on and how best I can help you. Is that okay? Yeah, you said it is affecting your daily life.
No, no,
No, okay. Do you have any rash in your body?
no, no,
Okay. Has anything affecting or worsening your fever?
no,
Anything improving?
no.
Did you have any recent travel history?
Yes,
Okay. When did you travel and when did you travel?
1 month ago,
1 month ago. Okay. When did you return?
last night,
Okay. Where did you travel?
Malaysia.
Malaysia. Okay. Where did you stay there in Malaysia?
I stayed in hostel with my friends.
Okay. Uh, and what kind of activity you have done there in Malaysia?
We visited some mountains in rural area, and we visited also zoo. We saw many animals.
Okay. Prior to your trip, did you take any immunization?
No immunization, no prophylaxis.
Okay. Other than this fever, any other complaints you are having, like headache,
No,
any loss of consciousness,
no,
any jerky moments,
no,
any vision problem,
no,
any chest pain,
no,
any sore throat,
no,
any shortness of breath,
no,
any heart racing,
no,
any tummy pain,
no,
vomitings or loose stools.
no,
Okay. Any uh, pain while passing urine. Okay. Any decreased or increased urine output.
no,
Okay. So you have a temperature and anything change in your color of the skin, in
no.
your eyes or in your body? No. Okay. Uh, I would like to ask you a few more questions regarding your personal history. Do you have any past medical disease?
No, no,
Do you have any surgical history?
no.
Are you on any prescribed medication given by a doctor? Okay. Any diseases running in your family?
No,
Okay. Any allergies?
no.
Where do you live and what do you do, Mr. Kali?
I'm living with my family in downtown.
Okay. Uh, by any chance, do you drink alcohol, smoke cigarette,
No,
or use of any illicit drugs?
no,
Okay. Would you like to add anything else, Mr. Kali?
no.
Okay. What do you think about your problem? What is your idea? Do you have any idea?
What is the problem, doctor?
Okay. According to your data, I am suspecting you are having a fever after came from Malaysia. So it is 3 weeks back, and it is gradually on and off and worsening, right? So I am suspecting some kind of infection associated fever. So I would like to keep you in isolation observation room, do complete head to toe examination, and do blood test, including complete blood pressure, liver function test, and as well as kidney function test, and do infection screening like inflammatory markers, and once the reports come, I will let you know what is the diagnosis. Right now, I'm suspecting some kind of bacterial or parasitic or viral kind of infection. So I need you to keep in the isolation and do the.
So I will stay in the hospital or I will go home.
See, once the reports everything is normal, we will discharge you. This thing. If it is the reports are abnormal, then we have to plan for admission. Is
So
that
is it serious, doctor?
Right now, I don't think it is serious, Mr. Khalid, because you're not having any warning signs. You are having only complaints of fever. So,
Okay, thank you.
no,
Thank you. Okay. Your time almost done.
sir.
Well done, Emmanuel.
Yes,
Here, the patient has temperature.
yes, sir.
When you ask the patient anything cause or worsen it, better than to ask anything worsen it. So anything cause or worsen it, okay?
Yes, sir.
This patient has temperature after travel to different
Malaysia.
country.
Yes, sir.
So you finish the part one and then travel history. Okay. You ask the questions of travel history and then Odebara finished already. Review systems. I said start by saying yes, musculoskeletal. Okay. I think you need to memorize the general approach very well by the same way. Okay.
Yes, sir.
So at least when you are doing practice, put the approach in front of you. Write the approach in paper, put in front of you. I will be happy
Sir.
if you practice from paper correctly. I will be happy. Okay.
Yes, sir.
So you ask these questions. How to know this station is serious or benign? Review of systems.
Yes, sir.
If the patient has jerk movements, serious. Vision problem, serious. Lost consciousness, serious. Numbness or weakness, serious. Okay. If
Yes,
the
sir.
patient has any change in bowel habits, so serious. Skin change, yellow color skin or eyes, serious. Okay. If the patient has any urethral discharge or blah blah blah, serious. If the patient has any chest pain, heart racing, serious. Shortness of breath, serious. Why? It means organ failure.
Yes,
So
sir.
if the patient travel to any country and, for example, has sinus symptoms, it means brain injury. If the patient has GIT symptoms, it means liver injury or kidney injury. Okay. So if the patient said, for example, yes, I have yellow color of my skin, I have dark urine, dark stool, so liver injury. The patient said a change in urine. I'm not passing urine for 3 days, so kidney injury. If the patient said chest pain or heart racing or shortness of breath, it could be heart injury or lung injury. Okay. So this may be complication of infection, whatever infection, like malaria, like any serious infection. Do you need to mention malaria by name? It's not mandatory. So you can say you have temperature, it could be infection, and this happened after your travel. So it could be related to your recent travel. But you have no worrying symptoms. More than enough. Okay. If the patient has worrying symptoms, you will mention them. For example, he said, I have jerky movements, I have blah blah. So you can say, oh, I'm sorry, you have some worrying symptoms like blah 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 blah. It could be brain injury, for example. Clear, guys?
Yes, sir.
So if the patient has any serious symptoms, it could be cerebral malaria. Cerebral malaria doesn't mean in the brain only. Cerebral malaria can affect all the organs. Okay. So if the patient has no worrying symptoms, it could be benign type of malaria. Okay. So here you can keep the patient in isolation room and do complete physical examination from head to toe. Then you will do some blood tests, including infection screen. Start by infection screen, then inflammatory markers, then blood profile, and organ function. Mention them one by one. For example, liver, kidney, heart functions, and the lung functions also. Then you will give him two possibilities. Start by the likely possibility. This patient has only fever and no worrying symptoms, then you can start by the likely possibility discharge. If the patient has worrying symptoms, start by the likely decision, which is
Discharge.
admission.
Admission, isolation.
If the patient has no worrying symptoms, start by the likely decision, which is discharge. If the patient has worrying symptoms, start by the likely decision, which is
Admission.
Admission.
admission. This how to think in any station, guys. Okay. So patient has any complaint. If you feel this complaint with worrying symptoms, for example, the patient has lost weight, the patient has blah, 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 blah. So start by the likely decision. So you can say it could be admission because you have blah, 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 like that. Okay. Anyway, so give him two possibility. You can say, since you don't have any worrying symptoms, we will wait for your results. And if we find all normal, then we can discharge you with printed leaflet and uh, antibiotics. Okay. If you find any, then give the unlikely decision. If you find any abnormal results, like for example, you have infection like malaria or any different kind of parasite or infection, then we can give you treatment accordingly. Okay. So malaria doesn't mean admission. Malaria itself doesn't mean admission, but infection plus worrying symptoms, it means organ injury, it means admission. Okay. If the patient has diarrhea, and this is diarrhea because of travel, this needs admission. So any travel diarrhea, especially with loose bowel motion and especially with blood in the loose bowel motion, so this patient needs admission. Okay, I will give you 8 out of 10, doctor. Thank you.
Dr.
Sir,
Hani.
I have a doubt, sir.
Yes, please.
Sir, in review of systems like urogenital, if a patient is having like urethral discharge and as well as any like blood while passing urine, can I go for any sexual history there in travel history, sir?
If the patient has urethral discharge and, for example, ulcers in skin, okay, in genital areas, ask him about sexual history,
Sir.
very concise, okay?
Sir, okay, sir.
For example, you can say you have urethral discharge and some ulcers in the skin in the genital areas. So, did you get any sexual act at this travel? For example, he said yes. You can ask him again. I need to ask you some questions relevant to sexual history. I'm asking all patients. Easy?
Yes. Yes, sir.
Then you will ask for B's. You can ask uh, how many partners apart from your regular partner. Okay.
Yes, sir.
Then you will ask about male or female. You will ask about was it vaginal, anal, or oral, or all. You will ask was it protected or not. Clear?
Yes, sir.
More than enough. Okay. But anyway, unlikely because if they want to test sexual history, they will give you clear station for sexual history. For example, the patient has urethral discharge. The complaint is urethral discharge. Easy?
Yes, sir.
Okay. Next one, Nagla,
Dr.
again?
Hani, please.
Yes.
Just a question. Is there is any possibility the examiner may ask me about a specific treatment for cerebral malaria?
It could be.
The patient, if
The,
the patient
the
is worrying symptoms.
if the patient give you serious worrying symptoms, then for example, you said it could be a serious infection. I'm sorry to say that, like malaria or different infection. We will do screening. Okay. Then what if the actor asks you which type of infection? You can say, for example, malaria. He said, which type of malaria? You can say, I'm sorry to say, serious type of malaria, which is called cerebral malaria. Clear?
Yes.
Because the patient has, for example, CNS symptoms, liver symptoms, kidney symptoms, heart symptoms, respiratory symptoms, like that. Okay.
Yes.
Next one, Nagla, get. So we will skip this one because it will be the same. Okay. We will go for next station. Okay. Sexual history. Sexual history. So the patient has burning micturition. In burning micturition doesn't mean sexual symptoms. Okay. So here you have genital symptoms and KUB symptoms. Okay. Clear, Nagla?
Yes.
So the patient has genital symptoms and KUB symptoms. Okay. Burning micturition is KUB or genital?
Sorry, doctor, can you repeat?
Burning micturition is
It's
KUB
KUB.
symptom or genital symptom?
It's KUB symptom.
KUB symptom. So if I
Yes.
say the patient has burning micturition, I am taking sexual history. Why? For genital symptoms or for KUB symptoms?
For
Genital.
genital. Yeah.
Sexual history. Why I'm taking sexual history? Why I'm asking the patient about sexual history to understand he has genital symptoms or not. Easy?
Yeah.
Clear, guys? This point, please answer me.
Yes, sir. Yes.
Yes, sir.
So I'm
Doctor,
taking sexual history from the patient to understand he has genital symptoms or not. It means he needs the intervention or not. It means he needs the management or not. He needs the antibiotic or not. He needs the post-exposure prophylaxis or not. So if the patient has burn micturition, I don't care. If the patient has any change in urine, I don't care. I will care about what? Urethral discharge, genital
Skin
areas,
tone.
skin changes or ulcers. Easy? Okay. So if the patient has genital symptoms, it means symptomatic. If he has no genital symptoms, I will say
Asymptomatic.
asymptomatic. Okay. Even he has burning micturition, I don't care about burning micturition now. Okay. I will treat burning micturition, but I'm caring about sexual history now. Okay. So if the patient has no genital symptoms, I consider asymptomatic. Asymptomatic, it could be high risk to get symptoms or low risk to get symptoms.
Yeah.
It means this patient, I want to understand, he will get urethral discharge or ulcers
In the future or not?
in few days or not. Easy?
Hmm.
It depends on high risk or low risk. For example, the Royal College, they are clear. If they want to give you high blood pressure, they will say 250 over 150. If they want to say hypotension, they will say 70 over 30. Easy? So
Easy.
high risk, they will give you 5 partners. Low risk, they will say 1 partner, apart from the regular partner. Clear?
Yes.
So the patient has regular partner. This regular partner, whatever husband or a stable relationship, I don't care. Regular partner. Okay. So you are asking sexual history about the non-regular partner. Easy. Anyway, so if the patient has 5 partner apart from regular partner, so we are considering high risk. If the patient has only 1 partner, so low risk. Clear? Okay.
Yes.
So if the patient has symptoms, is it logic to say high risk or low risk?
No.
No, because he has symptoms also. Okay.
So,
So when to say high risk or low risk? If the
if
patient
he's
asymptomatic. Asymptomatic genital or KOB?
asymptomatic genital.
Genital. I'm talking about genital. Okay. So if he has no symptoms, here you should understand high risk or low risk. Okay. What else apart from the partners? If the patient has anal sex. So high risk if the partners more than, for example, 4 or 5. If the practice is anal. Okay. What else? If the protection, not protected, it's irrelevant. Again, guys, the protection irrelevant. For example, the patient said it was not protected, irrelevant. I mean, if one partner and it was vaginal and not protected, this is low risk. Clear?
Mm.
He went to say high risk,
Ah,
more than 3 or 4 or 5 partners. It will be obvious in the exam, for example, 5 partners. If the protection irrelevant, I will not comment, but the practice is anal. Okay, so
yeah.
you will say high risk to get symptoms. Okay, so what is the management here? If the patient symptomatic or asymptomatic but high risk, same management. It means complete physical examination with chaperone, examine from head to toe, including the tummy genital areas, examine you will refer to genitourinary medicine clinic. You will do some blood test, including virology. So inflammatory marker infection screen, including virology. You will give post-exposure prophylaxis if the sexual act within 72 hours. Sexual act, not the symptoms. If the sexual act within 72 hours, then antibiotic. I said here antibiotic, I said here antibiotic. So what is the difference? Here, the patient has symptoms. So this antibiotic, active treatment or prophylactic?
Active treatment.
Okay, and this one asymptomatic. So antibiotic active or prophylactic?
Prophylactic.
Prophylactic. This is the only difference. Easy. The
Yeah.
patient asymptomatic, but only one partner and no anal sex. So what you will do?
Discharge. The
Easy?
GP leaflet.
Easy?
Yes, inshallah.
Okay. So what if the patient asymptomatic from the point of genital symptoms, but he has burning micturition? Does it charge after treating what?
Burning micturition.
So burning micturition, it means kidney function and urine test. If the kidney function normal, urine test normal, or some uh, crystals or a small infection, you will give just advice for plenty of water. If the patient has severe infection, you will give antibiotic. If the patient has kidney function impaired, you will refer to urologist. Easy?
Yeah.
Okay. What if the patient has genital symptoms, but no sexual act? It means non-sexual transmitted infection. Easy?
Mm.
So genital symptoms with sexual act, we will say sexual transmitted infection. Genital symptom without sexual act, it means non-sexual transmitted infection. I wish it's clear. Unlikely to be in the exam because they will give you sexual act, okay?
Okay.
So what are the questions? So in the beginning, I want to ask you routine questions. I'm asking all patients, are you currently sexually active? Then ask 4 Bs. Before I'm saying 6 Bs, I make concise. You can get 10 out of 10 with 4 Bs? Yes. How many partner apart from your regular partner? Okay. Male or female? How much do you know so far about your partner? From different country? If the patient from different country, I mean the partner from different country, high risk. If the patient from same area, from same country, low risk. Clear, Nagla?
Yeah.
Pregnancy. This question of pregnancy for the regular partner. So other questions for non-regular partner, but this question of pregnancy for the regular partner. Why? Because I want to notify or not. So if the patient is male, are you trying to get your regular partner pregnant? If the patient is female, is your regular partner trying to get you pregnant? Then protection. Was it protected sex? Was it consensual? This consensual question not important, but why I'm asking, so if non-consensual, you will call police. Practice.
Mm.
Was it vaginal, oral, anal, or oral? Okay, so you have 3 points to assess high or low risk. Number one, the number. Number two, from different country or not. Number three, anal or not. Accordingly, you will understand if the patient has no symptoms. Okay, so in the beginning, you will take special consent. So I need to take some data regarding what your sexual health. We are in private room with a chaperone. Anything you will tell me will be confidential. And You can stop me at any time. So you should mention this introduction in any sexual history. They said here sexual history. What if they said take history without the term sexual? You will take sexual history?
No.
Yes.
No.
Yes.
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 I will ask when I started the urogenital. If I
Yes.
ask I have
Yes.
urethral discharge, then I will
No, no,
tell
no, 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 no. You should take sexual history. Okay?
Mm.
So if they did not mention take sexual history and you find the complaint burn micturition, you should take sexual history. Easy, guys?
Okay.
Okay.
Because this happened in previous exams. Okay? So if they did not mention take sexual history, if you find the complaint is burning micturition or dysuria or urethral discharge, so you will take sexual history. Anyway, you have 30 seconds and 6 seconds. I want you guys to check with Nagla. I want you to give feedback and understand it will be symptomatic or not. If not symptomatic, check if low risk or high risk. Okay, check the sexual act onset. Check the symptoms onset. I don't care about the symptoms onset. I care about the sexual act onset. Easy? Okay. Do you need to take all review of systems?
No.
The most important is
Urogenital, GIT.
a female menstrual, genitourinary, and GIT. If male, genitourinary, and GIT only. Easy?
Mm.
Okay. What if you ask other symptoms, other review of systems? No problem, don't worry. Okay? But I'm caring about your time.
Mm.
Okay.
Okay. I will start.
It's up to you.
Yeah, okay. Hello, my name is Dr. Najla. I'm emergency registrar. May I confirm your name and age, please?
I'm Karim. I'm 43.
Nice to meet you, Karim. How can I help you today?
Yeah, I have burning micturition, doctor.
Sorry to hear that. Are you comfortable now?
It's okay. The nurse give me painkiller.
Okay. Um, uh, I want to take some history from you regarding your complaint, and I will take you to a private area, and all the question will be confidential between me and you. Is it okay with you, Mr. Karim?
Yes.
Okay. Can you tell me more about this complaint, the burning micturition?
Yeah, the problem started 2 days ago and started gradual increasing, worsening, and continuous.
So you told me that it started 2 days ago, gradual, and it becomes like continuous in the burning sensation that you feel. Am I right?
Yes.
Okay. Um, uh, is it affect in these 2 days? Is it affecting your daily life?
No, no.
Is it worsening or improving, or it's the same?
I, s- I said already it's worsening and continuous.
Okay. Did you have you had this problem before?
No, no.
Okay. Do you think that anything can improve the symptoms in these 2 days? Okay. As I told you, I want to ask you some specific questions, but first of all, do you have any urethral discharge with this burning micturition?
No, no.
Okay. Um, do you notice that there is any change in urine color?
No, no.
Do you notice that you have any change on the genital area, like a rash or the ulcer?
No, no, no.
Okay. Do you feel that you have any change in your bowel habit?
No,
Do you feel sick?
no, no.
Do you throw out?
No,
Do you notice that you have any change in the color of your eyes or skin?
no, no.
Okay. As I told you, I'm asking you some private questions about your sexual history. Are you sexually active, Mr. Karim?
Yeah, I think this happened after sexual act 5 days ago.
So it happened after sexual act 5 days ago. How many partners apart from the regular partner? Uh,
Only one partner,
and is it a male or female?
female.
So only one partner, and she's a female. Do you know anything about your partner?
And she is from the same area. She's working with me.
So she's working with you and in the same area.
Yeah, yeah.
Okay. Do you want to get your partner to be pregnant?
You mean which partner?
The one that you did sex with her. Do you want to get her pregnant?
Regular partner.
Your regular partner. Do you want to get
Yeah,
her
yeah,
pregnant?
yeah. We have a deal about that. Yes.
Okay. And you told me that the last sex you had was 5 days. Am I right?
Yeah.
What was the act? Was it vaginal, anal, or oral?
It was vagina.
Vaginal. Okay. And was it protected?
No, no,
No. Okay. Um, okay. I want to ask you another question. Do you notice that you have headache,
no, no,
jerky movement?
no,
Do you notice that you have any numbness,
no,
any weakness,
no,
any chest pain,
no,
shortness of breathing, any fever?
no,
Okay. Any sweating,
no,
any loss of weight or appetite?
no,
Okay. Any lumps and bumps in your body appears in this 2 to 5 days?
no, no,
Okay. But do you have any medical illness?
no,
Do you have any allergies?
no,
Any previous surgery?
no,
Do you have any disease running in your family?
no.
Where do you live and with whom, Mr. Karim?
I'm living with my regular partner in downtown.
Okay. And what do you do for a living?
Receptionist.
Okay. Do you smoke?
No,
Do you drink alcohol?
no,
By any chance, are you taking any illicit drugs?
no,
Okay. Do you want to add anything, Mr. Karim?
no.
Okay. So what's your concern, Mr. Karim?
What is the problem, doctor? Is it serious? And I heard about post-exposure prophylaxis after sexual act, and I came for this issue.
Mhm. I appreciate your concern, Mr. Karim. From the history that I gathered from you, till now there is no serious problem. The only thing that you have is burning maturation. And you told me that you have only one regular partner and no like genital symptoms that you have. So the only thing that you have is a burning maturation. Are you following me, Mr. Karim? But I will, anyway, we will do some examination for your genital area. And I will, as I told you, I will examine you. I will do some investigation for your urine. And I will do some inflammatory markers for it to check that what kind of the things that causing your burning maturation. Are you following me? After the result, as I told you, we will discharge you with a leaflet and referral to your GP. Is it okay with you?
So, will you give me post-exposure prophylaxis, doctor?
Um, Till now, we cannot say that you need a post-exposure prophylaxis because it's just burning maturation and you are having sex with your regular partner. And it's still you have in a low risk.
Okay, thank you. So, the sexual act with the regular partner or non-regular partner?
With the regular partner.
No, the sexual act with non-regular partner. Okay.
Oh, أنا سمعت. I didn't hear it right. Oh my God.
Anyway, this patient has low risk or high risk?
Low risk.
Low risk because only one non-regular partner,
One
the
regular.
no
One.
no anal sex, and from the same area, right?
أيوة. But
Okay.
I didn't get that it's one. Sorry about that. Okay.
Okay. So here the questions, all questions for the non-regular partner, only pregnancy for the regular partner. Clear?
Okay.
Why I'm asking this question? Because, for example, if the patient has low risk, no need to notify the regular partner. Clear? If,
Okay.
if the patient has low risk, no need to notify the regular partner because low risk.
Mm.
If the patient has symptoms or high risk to get symptoms, you will notify the regular partner. Easy.
Mm.
What if the regular partner has no plan for pregnancy? No need to notify. Why?
Mm.
Because they don't have plan for pregnancy. It means they are using barriers. Clear?
Yeah.
Why you will notify? Already they are using barrier. Okay. But
Mm.
for the purpose of the exam, if you find the patient has symptoms or high risk to get symptoms, notify whatever they have plan or not. Okay.
Okay.
So anyway, I think you did well. I said no need for other review of systems, but you ask them, no problem.
It's just
It
one
will,
question, please, just to make it very quickly.
yes, please.
I just asked one question from each system, just to make
No
it very
problem, no problem. Even if you ask all, it's not a big issue. I mean, just to save time. Okay. So
quick.
here, the patient has burning micturition. In the start, you have to provide chaperone. In the examination, you did not provide chaperone. So you
Mhm.
should say, I need to examine you
This chapter.
in a private room with a chaperone. Examine you from head to toe. Examine your tummy, your genital areas. What else he will do? Also inflammatory markers, infection screen, and then you can say, according to your data, you don't have any genital symptoms like urethral discharge. You don't have any ulcers in genital areas. I need to confirm that in examination. What else you can say regarding the burn micturition? It could be relevant to your kidney, ureter, bladder system. Since you don't have tummy pain, so unlikely to be stones, right? So he went to catch stones if the patient has tummy pain with burning micturition. So you
Yeah.
can say, since you don't have any tummy pain, so this unlikely to be stones. It could be some crystals or some small infection in the urine. For this reason, we will do kidney function and urine test and manage you accordingly. Until here, you can get 10 out of 10. You still have time, you can explain more. So if we find the kidney function urine test normal, then we can discharge you with printed leaflet, discharge letter to your GP. And if we find any problem in the kidney function or any problem in the urine, we can manage you accordingly. Until now, you are on safe side. What if you still have time? Give him, explain more. So you can tell him if the kidney function normal and urine test severe infection, we can give you antibiotic and discharge you. But if kidney function is abnormal, we can refer you to urologist. Easy?
Yeah. Okay.
Okay.
I
I
have
will. Yeah.
the Hani. If he said that the partner, the female, have vaginal discharge and she's not only one
I
partner,
don't care. I don't care.
it's still.
If the partner has symptoms, if the partner has symptoms,
Mhm. Yeah.
uh, this is not, this is not important.
It will be like asymptomatic but low risk.
If the patient has more than two or three or four partners, I will say high risk. If the patient has anal sex, this is high risk. Okay. If the
Mm.
patient in the exam they mention, for example, the partner is using illicit drugs or they have urethral discharge, it means the examiner want to give you high risk. But again, they are very clear. I mean, for example, if they will give you this clue, with more partner. Did you get my point?
Yeah. Okay.
They will not give you borderline decision. No. I wish you understand me. For example, if they will say four partners, anal sex, and the partner has illicit drugs or urethral discharge. Did you get my point?
Yeah.
So they will give you all, not only 1 point. I wish it's clear.
Yeah, it's clear. Yeah, thank you.
What if you find the patient has the partner has urethral discharge, for example, in the exam, and one partner, one non-regular partner, for example.
Mm.
I want you to think loudly in front of the examiner. You can say, according to your data, you have only one non-regular partner, and this is low risk. You don't have any anal sex, and this is low risk. But I have concern because your non-regular partner has urethral discharge. Here, if you will give post-exposure prophylaxis, no problem.
Mm.
So think loudly in the exam. Easy?
Okay. Okay.
Okay.
Thank
Next
you.
one, I will give you 8 out of 10. Next one, Ahmed.
Thank you.
Yes, Dr. Hani.
Sir,
Yes, please.
I have a question.
Your voice is
Before,
distorted. Your voice is distorted. You can fix your signal and you can ask at any time. Okay, next
okay.
station,
Yes, Dr. Hani.
menstruation stopped. So here, no need for Odibara. You can, for example, the rubber empathy, sympathy, and then comfortability, pain, and blah, 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 blah. Then you can jump to review of systems directly. Easy.
Yes, Doctor.
So, for example, here the most relevant system will be ministerial, then urogenital, then GIT. Why ministerial? Because menstruation, right?
Yes.
Okay. Then other systems. What if the patient has, for example, you ask her about review system. She said, I have headache, jerky movements, and anything relevant to CNS. What is the problem?
Pituitary.
Relevant to pituitary gland. Excellent. Okay. So no need to think in specific diagnosis. Ask the general approach, and according to the answers, you will catch the diagnosis. What if the patient said numbness or weakness? It means pituitary.
Yes.
So anything relevant to CNS musculoskeletal, what is the diagnosis?
Pituitary.
Pituitary gland. If the patient said a change in voice, loss of weight, okay, and heart racing, what is the diagnosis?
Thyroid gland.
Thyroid. So if the patient has loss of weight, so hyperthyroidism, gain weight,
Hypo.
hypothyroidism. So it could be hypo, it could be hyperthyroidism. So if the patient has heart racing, ask, this heart racing is slow or fast? Heart racing doesn't mean fast. Heart racing means arrhythmia. Clear?
Yes.
Okay. So if the patient has tummy pain, think about what?
Ovarian.
So polycystic ovaries. Okay. If the patient has, for example, using contraceptive pills, maybe because of contraception, but unlikely to be like that in the exam. Okay. So anyway, just ask the same questions, same general approach, and you will catch the diagnosis. Okay. You have 30 seconds and 6 minutes.
Can I start?
You
Can I
can
start?
start. Yes.
Good morning. I am Dr. Ahmed, ED Registrar. May I know your name and age, please?
Yeah, I am Karima. I am 43.
Nice to meet you, Mrs. Karima. How can I help you?
Yeah, I have no ministerial period, doctor.
Okay, I need to take some data from you regarding your menstruation. Is it okay for you?
Yes.
Can you tell me more about your problem?
Yeah, the problem started 5 months ago. I have no menstruation. For consecutive, every month in the 5 months, I have no periods.
So you told me that you have no period since 5 months consecutive. Every month you don't have period. Is it okay? Can you tell me when was your last menstrual period? Can you tell me?
I
Yes,
told you
five months.
yes.
Yes, yes. When was first menstrual period?
I was 14.
14. How were your periods? It's regular or irregular?
Regular.
Any problem with your period?
No, no.
Okay. Do you have any headache?
No,
Any jerky movement?
no, no,
Any vision problem?
no,
Do you lose your consciousness?
no,
Any numbness?
no,
Any weakness? Any trauma?
no,
Any change in bowel habit?
no,
Do you feel sick?
no,
Do you throw up?
no,
Any yellow color of skin or eyes?
no,
Any change in urine?
no,
Any urethral discharge?
no,
Any ulcer of skin? Changes in genital area?
no, no,
Any chest pain?
no.
Any heart racing?
Yeah, I sometimes for 3 months I feel heart racing. Sometimes, yes.
What do you mean of heart racing? It is regular or irregular?
Regular,
It's fast or slow?
slow,
Any shortness of breath?
no,
Any cough?
no,
Any noisy breathing?
no,
Any skin changes?
no, no,
Any temperature?
no.
Any
But
night sweat?
I cannot tolerate cold.
Any night sweat?
No,
Any change in appetite?
no, no.
Any change in weight?
Yeah, I gain like 20 kilogram.
Okay. Any lump in your body?
No, no,
Okay. Any past medical disease?
no,
Any previous surgery?
no,
Any prescribed medicine?
no,
Any allergy?
no, no,
Any disease run in your family?
no.
Where do you live and with where do you live and with whom?
I've my husband in downtown.
What do you do for living?
I'm retired.
Do you smoke, drink alcohol, or by any chance use any illicit drug?
No, no.
What is your concern? What is your concern, Mrs. Karima?
What is the problem, doctor? Is it serious?
I appreciate your concern. According to your data, that your menstruation stopped since 5 months, and every month you don't have period, and you have heart racing, slow heart racing, regular, and you don't have any lump in your body, and you can't tolerate cold. It could be relevant to your thyroid gland, which some small gland in your neck, which call thyroid gland. For this reason, I need to keep you in observation room. I need to examine you from head to toe, do some special tests. I will examine your neck, head, neck, back of your eyes, and do some special tests regarding your thyroid and chemistry and any and the inflammatory marker. And according to the result, we will decide if we can discharge you or admit you. Is it okay for you? The mostly we can discharge you if everything normal, because you don't have any warning symptoms. Is it okay for you?
So, what about my weight? What about my heart racing? What about
For this reason, I will need to examine your heart. We do heart racing. We will do some blood test, and we will, regarding the test, we will treat you.
okay, thank you.
Thank you.
Your time almost done. Okay, well done, Ahmed. So the patient has heart racing. Also, if you ask, would you like to add anything? Maybe the patient will say, I have hoarseness of voice or anything like that. The patient has gain weight and cannot tolerate the cold. Okay, so maybe the patient will say lump in the neck or not, right?
Yes.
Okay, so you cannot rule out thyroid gland if no lump. Okay, so anyway, thyroid gland hypoactivity, which is called in medical term hypothyroidism. What you will do here if the patient gain weight and heart racing, you have to give the likely decision. For me, the likely decision refer to medical team. Okay, refer
Yeah.
to medical team. What if you will refer to gynae team? You said gynae team, for example. It's not a big issue. Don't worry. Okay. So this patient, if you manage the thyroid gland, the menstruation will be regular, right?
Yes.
Okay. So you have to do some, of course, examination from head to toe, examination of the neck as well. You will examine the heart, and you will do some imaging. Imaging, it means ultrasound scan of the neck, ultrasound scan of the tummy, and heart tracing as well, right?
Yeah.
Okay. So you will do some blood tests, including inflammatory markers, infection screen, and also pregnancy tests. Even she did not give you any clue for pregnancy, you have to do pregnancy test as well, okay?
Okay.
Serum and urine pregnancy test. You will do ultrasound scan we mentioned already for the tummy. You will do also thyroid hormone functions. Okay. What if you want to do pituitary? No problem. So you can do some blood tests including hormone functions. One of them is thyroid gland. Okay.
Yes, doctor.
Well done. Then you can say if we find any problem in examination or the blood test or blah 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 or the heart tracing, then we can refer you to the medical team now. Okay.
Yes.
Okay. If we find all normal, then we can discharge you to GB, discharge a letter to GB with printed leaflet. Okay. Well done. So I will give you 9 out of 10.
Thank you.
Next one, I think Khalid. Khalid.
Sir. Hello, yes, sir.
Okay. So the next station is bleeding. Nose bleeding, not common in MRChem OSCE, maybe common in final OSCE. Okay. So any bleeding, the same question, same approach. Okay. Now we have, for example, 5 to 7 stations of bleeding. Okay. So we will discuss the differential diagnosis and all will be the same. Clear, Khalid?
Yes, sir.
So, if the patient has trauma, you ask him any trauma, he said yes. What is the diagnosis?
Traumatic nosebleed.
Injury, simple.
Injury
Injury, okay? For example, the patient has knee pain. You ask him any trauma, he said yes. What is the diagnosis?
due to injury.
Injury. Easy? So, if knee pain was trauma, knee injury. If nose bleeding was trauma, so the diagnosis is nose injury. Easy?
Easy.
Okay. The patient is using, he denied trauma. The patient is using medicine for nose inflammation, or he's not using, but he has runny nose, itchiness in his nose. What is the diagnosis?
Rhinitis.
I don't care, infection or inflammation.
Infection, yes.
No need to think about something specific, okay? So it could be infection and or inflammation in the nose. More than enough. That's why the patient has bleeding. The patient denied everything, but when you ask him any blood thinning medication, any prescribed medicine, he said, yes, I'm using warfarin or aspirin or any blood thinning medication. What is the diagnosis?
Drug induced.
Blood thinning medication. Okay. If the patient denied these things and you ask him any past medical disease, he said, yes, I have blood disease, like for example, Willebrand disease, hemophilia, anything like that. So what is the diagnosis? What is the diagnosis?
Due to blood disease.
The blood disease. Okay. The patient said, I have headache. Okay. He denied everything. He said, I have headache. I have head symptoms. What is the diagnosis? What do you think, guys?
Hypertension.
Could be hypertension, right?
Yes.
Okay.
So it could be hypertension. That's why the patient has CNS symptoms, and that's why the patient has nose bleeding. Okay. So the nose and the head, what is the most relevant system after Odebara?
Same.
CNS.
CNS musculoskeletal.
Yes. Any anything in the head, CNS musculoskeletal. Easy.
Easy.
So for example, the patient has vision problem. Vision means the eye, eyewear in the head. So CNS musculoskeletal. The patient has ear problem, dizziness or ear symptoms. So the ear in the head, so CNS musculoskeletal. Nose. I don't care about the bleeding. I care about the nose, the site, nose wear in the head. So you start by what? CNS musculoskeletal. And the nose is window for air, right? What is the next relevant system?
Respiratory and serious.
Respiratory and cardiovascular. We are
Yes.
breathing from nose. So respiratory and cardiovascular. Clear?
Clear.
Okay. You have 30 seconds and 6 minutes.
Good afternoon. I'm Dr. Khalid, ER Registrar. May I know your name and age, please? Hi, Miss Nadia. Nice to meet you. How can I help you? Are you comfortable? Do you have any pain or discomfort?
I have bleeding per nose, doctor.
Oh, sorry to hear that. I need to take some data from you regarding your bleeding. Can you tell me more about it?
Yeah, the bleeding started today. I woke up, I found some nose bleeding in the pillow, on the pillow.
So you said that the bleeding start today. You were sleeping, you wake up, and you found bleed on your pillow. Is it right?
Yes.
Is it affecting your daily life?
No.
Is it worsening, improving, or staying same?
Yeah, I think stopped now.
Is it continuous or on and off?
It's stopped, doctor.
Stop. Any cause or worsen it or anything improving it?
Mm, no,
Have you had this problem before?
no.
Miss Nadia, do you have any headache?
No.
Any jerky movement?
No.
Any vision problem?
No.
Any numbness?
No.
Any weakness?
No.
Any trauma?
No.
Or do you have any chest pain?
No.
Any heart racing?
No.
Any dizziness?
No.
Any shortness of breath?
No.
Any cough?
No.
Any noisy breathing?
No.
Do you see any, how is your bowel and bladder?
I'm okay.
Do you feel sick?
No, no,
Do you throw up?
no,
Any yellow color skin change of your eyes or skin?
no, no,
Any change in your urine?
no,
Any urethral discharge?
no,
Any ulcer or skin changes in genital area?
no.
I will ask you about your bleeding. How much teaspoon or cup the bleed came?
The bleeding like teaspoon.
Okay, any clots were there?
No, no,
Do you have bleeding from any other orifices?
no, no.
Miss Nadia, do you have any past medical disease?
I remember when I was young, I have blood disease, but I cannot remember, doctor.
Are you on any blood transfusion for that?
Yeah, they asked me, but I was for 15 years. Okay, that's why I ignored this issue.
Any
I
previous
remember
surgery?
the blood disease. It was like von something like that.
Okay. Any previous surgery?
No, no,
Any prescribed medication?
no, no,
Any disease run in your family?
no, no,
Miss Nadia, I would like to ask you some social question, which usually I ask all my patients. Do you smoke,
no,
drink alcohol,
no,
or by any chance do you use any illicit drug?
no, no.
What you do for living?
I'm teacher.
Would you like to add what you would you like to add anything?
No.
What is your concern?
What is the problem, doctor? Is it serious?
Ms. Nadia, as per the data provided by you, you told me that you have an blood disease and it was one Wellebrandt disease was there 15 years back. So this bleeding can be related to your bleeding disorder. So for this, I will keep you in observation room, do complete physical examination, including your nose, behind your head, behind your eyes and nerve. And I will be running some blood tests for you, including your complete blood count, your coagulation profile, or your infection screen. If you find that your blood reports are normal, we can discharge you to your GP with printer lifted. And if we find that your blood reports are worrying, we can admit you. Is my plan of care clear to you?
Okay. Okay, thank you. Thank you, Khalid. You still have almost 1 minute. Okay, what do you think, Khalid?
I think again, same management plan I just mixed up with.
You are doing well. Here, the patient has a nose problem. So after Odebara, you can start by CNS musculoskeletal. In CNS, you will ask the same questions of CNS. Then you can add any nose symptoms like pain, discharge. Easy.
Okay.
For example, the patient has vision problem, different station, vision problem. What is the most relevant system?
CNS musculoskeletal.
Excellent. You will ask CNS questions, then you will ask about vision problem. Is it double vision? Is it complete loss of vision? Is it halos?
Yes.
Did you get my point?
Yes, yes, I got it.
So in any complaint, ask about this complaint where in the most relevant system. A special analysis for this complaint where in the most relevant system. Easy?
Easy.
Here you will catch the problem, is it localized or generalized? I mean, the problem from the same organ or different organ. Easy?
Easy.
Okay. So here, if you ask me, I will deny no symptoms, no pain, and no discharge. If the patient has pain or discharge, so inflammation and or infection. If the patient has no, so it's a no. Okay. You did well. So the patient denied everything but admit blood disease. When the patient say blood disease cannot remember, remind the patient. You can say, is it like von Willebrand disease, thalassemia, sickle cell disease. By this way, you are reminding the actor and showing the examiner that you are familiar with the differential diagnosis of blood disease. Easy?
Easy, sir.
Yes. And this is good communication skill also, because you are trying to help the actor or trying to help the patient. Okay, well done. So what you will do, here you have to correct the patient neglect the blood disease. Anyone with blood disease, for sure, you are expecting using blood transfusion, using prescribed medicine, or follow up with his physician. But this patient, it seems he's neglecting himself, right? So you can say, I can see, unfortunately, you are not following up with a blood doctor. You are not using any blood transfusion. You are not using any blah, blah, blah. So for this reason, I will keep you in observation room, do blah, 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 blah. The general management plan of any history. Then blood test, including inflammatory marker, infection screen, and the blood profile. What else? Group and say. What else? Cross match. Easy, Khalid?
Good. Yes, sir. Yes, I
Any
follow.
bleeding, you have to add this point, whatever history or examination. Okay. So you are perfect. I'm trying to optimize your approach. Okay. So
Yes, sir.
you will add blood profile, group and safe, cross match, and accordingly, you will correct the blood disorder. Okay. Correct here, it means, for example, if the patient has any missed factor, or you can replace any factor, you can replace. Easy?
Easy.
Okay. If the patient has low hemoglobin, it means you will give blood transfusion as well. Okay.
Yes, sir.
So you did well. This patient likely decision to admit. Okay. Likely
Yes.
decision to admit. Okay. Well done. So I will give you 9 out of 10. Well done. Next one, Ali.
Yes, sir.
How are you?
I'm fine, thank you.
Yes. So the next station will be bleeding also. So it will be post-tonsillectomy bleeding. What is the
Okay.
decision here?
For admission under ENT specialist.
Yes, 24 hours.
200, yes, for 20 hours.
Even he is stable now? Yes. Even he has no bleeding now? Yes. Even he is good now? Yes. Even he want to go? Yes. Easy?
Yes, sir.
Okay. So post-tonsillectomy tonsil. So what is the relevant system here? Tonsil is head
Uh,
and the neck. What is
yes,
the
CNS and
and excellent.
musculoskeletal
And the tonsil in
and
the mouth. Window for
mouth.
air, for food, for water.
Respiratory and cardiovascular plus GIT and
Excellent.
urogenital.
Excellent. Very well. Excellent. Easy.
Yes.
Okay. This is how to think about any history, guys. Okay. So already you know the approach of the para. Already you know the review of systems. Already you know the decision, and you will give general management plan. Clear? If the patient
Yes.
said anything cause or worsen it, he said, I have surgery 3 days ago, tonsillectomy. So now it's a post-tonsillectomy bleeding.
Yes, sir.
Okay. So if the patient discharge, he has no issue, and you ask him any trauma, he said yes. I fell down last night. So what is the cause?
If trauma after trauma,
Yes.
it
Injury.
could be a fracture.
Injury.
Yes, injury.
Injury.
Yes.
Injury. Why I will
Yes.
think about injury? Easy.
Okay. Yes.
So according to your data, the most likely problem is injury. Done. Okay.
Okay, sir.
The patient
Uh,
denied trauma. He said no trauma. You ask him any bleeding from other orifice. He said yes. And
so,
you ask him any past medical disease. He said yes, I have blood disease. So what is the
so
cause?
it's due to bleeding disorder,
But okay, blood disease. He
blood
said
disease.
I'm using blood thinning medication. So this is the reason. Okay.
Yes. Yes.
He said uh, anything he will mention in the exam. This is the reason. Okay.
Okay, sir. But I have a question, sir.
Yes.
If if the patient deny or refuse admission, so
Unlikely
how
to be
I
like that, but if he refused the admission, you can assess capacity, the 4 points. So if
okay,
he said no, tell him, did you understand He said, yes.
Yes.
Can you repeat that? Blah, 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 blah. I will explain the risk and the benefit for you. If you stay here, you will be under observation. If you go home, you might get bleeding again, and this will affect your airway, and this is harm for you. What is your final
Okay.
decision? He will say, blah, blah, blah. If he said, I want to go home, let him to go home. Easy.
Okay. Yeah, easy. Thank you, sir.
You have 30 seconds and 6 minutes.
Okay. Hello. Good evening. My name is Dr. Ali, the registrar. May I know your name and age, please?
Hadi 21.
Nice to meet you, Mr. Hadi. How can I help you today?
Yeah, I have bleeding per mouth, doctor.
Oh, I'm sorry to hear that. Are you comfortable? Do you have any pain now?
No, no, I'm okay now.
Do you still have the bleeding?
No, I'm okay now.
Okay, good. I need to take some data regarding your bleeding. Is it okay with you?
Yes, yes.
Okay, thank you. Can you tell me more about it?
Yeah, I woke up today. I found the blood on the pillow. But I checked my mouth. I don't have any bleeding.
Okay, thank you for information. You told me today you woke up in the morning and you found some blood in the pillow, but there is no bleeding anymore. Is that right?
Yes.
Okay, thank you. Does it affect your activity lives? I
No,
mean, live activity, sorry, live activity.
no, no, I'm okay now.
Okay. Can you tell me how much can you estimate the amount of bleeding, like a teaspoon or cup?
Like teaspoon on the pillow.
Okay. Is there clot with the bleeding?
No, no, no,
Okay. Do you have any bleeding from other orifice?
no, no,
Okay, thank you. Anything make it worse?
no,
Anything make it better?
no,
Okay, thank you. Do you have any headache?
no, no,
Any loss of consciousness?
no,
Any jerky movement?
no,
Any problem in your vision?
no,
Any trauma?
no, no,
Any weakness or numbness?
no,
Okay, thank you. Do you have any cough?
no,
Any shortness of breath?
no,
Any noise breath?
no, no,
Any chest pain?
no,
Any heart racing?
no, no,
Any dizziness?
no,
Okay, thank you. Do you have any tummy pain?
no,
Did you throw up?
no, no,
Do you feel sick?
no,
Any yellow color in your skin or eyes?
no,
Any change in your bowel habit?
no, no,
Any change in your urine color?
no,
Urethral discharge or dysuria?
no,
Do you have any high temperature?
no,
Any night sweats?
no,
Any lumps in your body?
no,
Any loss of weight or appetite?
no,
Okay, thank you for your information. I would like to ask you some question about your past medical history. Do you have any past medical disease?
no.
Any previous surgery?
Yeah, I did tonsillectomy 4 days ago, and I was discharged last night.
Okay, thank you. Do you have any prescribed medicine?
Mm, no, no,
Any allergy?
no.
Where you are living and with whom you are living?
With my family in downtown,
Okay, with what you do for living?
studying.
Do you smoke?
No, no,
Do you drink alcohol?
no,
By any chance, are you using any illicit drugs?
no,
Would you like to add anything?
no, no.
Okay, thank you. What is your concern, Mr. Hadi?
I have no concern. I'm okay now. I wonder if I can go home.
Okay, I appreciate your concern, Mr. Hadi, but let me explain about your case. According to your data, you have surgery, tonsillectomy before 4 days, and now today you wake up and you saw some blood on your pillow, This is most likely due to the surgery, tonsillectomy you did before 4 days. For this reason, I need to keep you in observation room. I will check your vital signs. I will do complete examination from head to toe, including your brain, nerve, back of eyes, also as well as no, sorry, oral, I mean, and nose and air. Then I will run blood tests, including your hematology, chemistry, blood profile, and blood and group cross match. As this is bleeding after tonsillectomy, so it is indicated for admission to for observation for 24 hours. So for that, I will call you for you the NT specialist.
No,
Is that
doctor,
clear?
I have studies. I'm busy.
Okay, I appreciate your feelings and concern, but I will check now. Let me check your mental capacity. Mr. Hadi, did you understand my
Yes,
plan
I
management?
understand.
Okay, can you repeat it, please?
Blah 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 blah.
Okay, I let me explain your benefit and risk. If you admitted in our hospital, the ENT specialist, the team will take care of your no bleeding and will provide the necessary care. Otherwise, maybe if you go home, maybe the bleeding will increase and you will have some complication. Did you understand what I told you?
Yes, yes.
Okay, so what is your final decision?
Yeah, yeah. I will go home, doctor.
Okay, thank you, Mr. Hadi. As you are adult and you have full mental capacity, I will agree to discharge you. But let me give you advice. You can come back immediately if you feel any bleeding or any abnormal
Thank
any
you.
increasing bleed.
Thank
Thank
you.
you. Thank you.
Are you happy now?
Me? Me?
Okay.
About for the mental capacity?
I run the station as you want. Okay.
Dr. Hani, because today we are in work, we face this problem,
Yes,
and
yes.
the patient refuse.
Okay.
And we
So
we uh,
number one, I will give you 10 out of 10 for
Thank you,
everything.
sir. Thank
You
you.
are doing very well. Accuracy, you mentioned all the point, 100%. Skillfulness, you are very fluent, 100%. Efficiency, structure, organized, 100%. Supportiveness, 100%. Safety, correct information, 100%. Regarding the decision, already you finished the mental capacity. You can say, according to your data, you are your age more than 18 years. You are alert. You are competent. You have mental capacity. For this reason, I should respect your decision. Okay. I can
Okay.
let you to go home with printed leaflet as a charge letter to your GP. Follow up with your GP. Now I will document all the procedure. I will document the mental capacity assessment in the file. Easy.
Yes, sir.
This how to communicate with the examiner as well. Okay.
Oh,
Um,
Dr.
you have
Hadi,
yes, please.
sorry, no rule of DAMA or left against medical advice in this topic.
Why will you don't need any data in real life? Okay. I know some hospitals they are using that. You have nurse, right? The nurse will document everything, and you'll document everything. Done. Okay. Anyway, you have to follow the local policies. If the hospital is recommending any paper, you can follow this paper, no problem. So this one, it's called self-discharge. Easy. Self-discharge, it means the patient
yes.
want discharge. So
Thank
he
you.
can sign self-discharge. Easy.
Yes,
Yes,
sir.
yes.
Okay, it means he is the one want to discharge. Okay. Um, but anyway, in the printed leaflet, you are giving him all advice. Okay. Next one, I think, Giovanna.
Yes, sir.
Yes. So the next station also bleeding, upper GI bleeds. So here the same questions, same everything. Okay.
Mm-hmm.
Um, if the patient said any trauma, he said yes. What is the diagnosis?
Injury
Injury. Okay. The patient denied trauma, but he said, I have blood disease. What is the diagnosis?
related to a blood disease.
Blood disease. If the patient said, In a prescribed medicine, he said, I'm using blood thinning medication, whatever, aspirin, blah, 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 blah. What is the diagnosis?
So it's a drug induced related to
Blood
blood
thinning
thinners.
medication. Blood thinning
Blood thin.
medication. Very
Yes.
simple. Okay. The patient said, denied everything, but he said, I have tummy pain. The tummy pain were in the upper part. It means the epigastrium. And he is using painkiller. So what is the diagnosis?
Could be peptic ulcer disease related
Stomach
to
ulcer.
diet.
Stomach ulcer. Clear?
Yes, sir. Yes, sir.
Stomach ulcer. Try to be simple. Okay.
Done.
If the patient said, for example, I vomited after vomiting, the first 3 or 4 vomiting without blood, and then after recurrent vomiting, I get chest pain, and after that, I found some blood in the vomit. What is the diagnosis?
Mallory-Weiss tear syndrome.
Yes, what is the non-medical term? Foot pipe,
Tear in a
partial
foot
tear.
pipe. Tear
Foot,
in a foot pipe. Yeah.
foot pipe, partial tear. Easy?
Yes, sir.
Foot pipe, partial tear. It means esophagus partial tear. Partial, not complete. So
Okay.
the superficial layer of the esophagus, what happened? Tear. That's why the patient has bleeding. It's not serious. Why not serious? Because not complete tear. Clear?
Yes, sir.
It means the stomach fluid or the esophagus fluid not going outside the food pipe. Easy?
Yes, sir.
Okay. So just follow the general approach, and then according to the clue, you will catch the diagnosis. So here you will use Odebara. Vomiting. What is the relevant system?
Gastrointestinal
And
and genitourinary.
urogenital.
Yes.
So GIT and urogenital, right?
Yes, sir.
Okay. What is your decision? If the patient has score more than 1, I'm talking about Blatchford score. If the patient has a score 1 only, you can do camera scan. Easy?
Yes, sir.
So if the patient has a score more than 1, what does it mean more than 1? It depends on the vital signs. It depends on the
Previous.
blood test. It depends on the medical disease. So you have 3 now. Vital signs. Number 2, blood test. Number 3,
Medical history.
blood disease. So vital signs, it means heart rate and systolic blood pressure. Okay. We don't have idea about them, but you can mention in general. Blood test, we don't have, but you can mention in general. So urea, hemoglobin. Blood disease, like what? Heart, liver, kidney. Even kidney not in Blatchford score. Okay. But what if you mention? No problem. Regarding, because it's mentioned in Rocali score. What about melena? So how to catch melena? The patient will say dark stool or blood in stool, right?
Yes, sir.
So it could be melena. So if the patient has one of them, one only, you will do camera scan. You or the gastroenterology, the endoscopist?
Gastroenterology.
Endoscopist, okay? So when to do camera scan? It depends on the vital signs. If the vital signs are normal, you can do camera scan within 24 hours. So you can refer the patient to medical team and they will arrange for camera scan within 24 hours. If the patient unstable, do you think the patient is unstable and he's talking to you?
No, sir.
Did they mention vital signs here?
No, sir.
No. So stable until proven otherwise. If they want to show you this patient unstable, they will say systolic blood pressure is blah blah blah. What will you do, guys, if you find blood pressure is low here? What you will do?
They'll move to the research room
Okay.
and place 2 large IV bore cannulas
Excellent.
and send for complete blood count, blood grouping, cross matching, and start IV fluids. And we'll wait for
Blood
a
transfusion. Start the blood
blood trans
transfusion.
Yes,
Clear?
sir. Yes.
The new guidelines now start blood transfusion with no fluid. If you don't have blood transfusion, give fluid. Easy? Okay.
Yes, sir.
Your task is history, not resuscitation, but you will give blood transfusion only and then take history. Easy?
Yes, sir.
So you can say like that if you find the systolic blood pressure is low. If they did not mention any vital signs in the scenario, you will just say, I will move the patient to observation room and check vital signs. More than enough.
Yes,
If
sir.
the examiner is silent, it means stable. Easy? Okay. Again, if they mention blood pressure is low or they wrote blood pressure is low, you will verbalize, please nurse, insert to IV access, extract the blood for blah, 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 and give the patient blood transfusion according to his blood group. Easy? In the
Yes, sir.
meantime, I will take history. Then you can discuss with the patient. I wish it's clear.
Yes, sir.
Okay. So here he went to do camera scan. If the patient is stable, within 24 hours. If the patient is unstable, you will do resuscitation first and then do camera scan after stabilization. It means immediately. It means now. Easy?
Yes, sir.
Okay. You have 30 seconds and 6 minutes.
Good morning. I'm Dr. Jivna, AD Register. May I know your name and age, please? Hi, Mr. Karim. Nice to meet you. How can I help you today?
I vomited blood, doctor.
Oh, I'm so sorry about that. Are you comfortable? Do you have any pain? Do you still have a vomiting in the blood?
No, no more vomiting now.
Okay, I'm here to, I'll be moving you to the research room, hook to the monitor and check your vital signs to make sure that you're okay. Is that okay with you?
Okay.
I'm here to collect some data regarding your problem. Can you tell me more about that?
Yeah, the problem started 3 days ago, and I think gradual increasing, worsening.
Okay. Okay, Mr. Karim, you said that your problem started 3 days ago, increasing, worsening. Is that right?
Yes.
Okay. Is it affecting your daily activities?
No, no,
Okay. Do you have similar complaints in the past?
no, no,
Anything that cause or worsen it?
no,
Anything that makes better?
no.
Can you tell me about your blood in the vomiting? Is it a fresh blood? What is the color?
The color is fresh red blood.
Okay. Is it associated with any clots?
No, no.
Can you tell me how much amount of blood have you noticed? Okay. Any bleeding from the other orifices?
No,
Okay. Do you feel sick?
no, no,
Do you have any tummy pain?
no,
Any yellowish discoloration of the skin?
no,
Any change in the bowel?
no, no.
Any change in urine?
No, but I think the stool is dark, and I found today like spots of blood.
I'm so sorry. So you said that your stool is dark colored and you found spots of blood. Is that right?
Yes.
Okay. Does it include any clots?
No, no,
Okay. And do you have any rash in your genital area?
no, no,
Do you have any cough?
no,
Any noisy breathing?
no,
Any shortness of breath?
no,
Any chest pain?
no,
Any heart racing?
no, no,
Do you have any headache?
no,
Any loss of consciousness?
no,
Any jerky movements?
no,
Any numbness or weakness of your limbs?
no,
Any history of trauma?
No.
Skin changes?
No.
Any night sweats?
No. No.
Any high temperature?
No.
Any change in your weight?
No.
Any change in your appetite?
No. No.
Any lumps or bumps in your body?
No.
Do you have any past medical diseases, Mr. Karim?
No.
Do you have any previous surgeries?
No.
Do you have any medications? Do you take any medications?
No.
Any allergies?
No.
Any diseases runs in your family?
No.
Okay. I'll be asking some more personal questions. These are the regular questions that we ask for every patient. Where do you live and whom do you live with, Mr. Karim?
With my family downtown.
What do you do for a living?
I'm receptionist.
Mhm. Do you smoke?
No.
Do you drink alcohol?
No. No.
By any chance, do you take any illicit drugs?
No.
Would you like to add anything, Mr. Karim? What is your concern, Mr. Karim?
What is the problem, doctor? Is it serious?
I appreciate your concern. As per the data I have collected, the most likely problem might be related to your food pipe. So for that, I need to keep you in the research room and do a complete examination, which includes the complete tummy and I'll be sending a blood test that includes the full blood count, coagulation profile, blood grouping, and cross matching. And as per the reports, the most likely you might be having a tear or ulcer in your food pipe, which we medically call as an upper GI bleed. So for this, I need to keep you in the observation room and do this blood test. And if any signs or blood test comes out to be abnormal, I'll be doing a camera scan and I'll be referring you to a gastroenterology. If any of the warning symptoms are not found, I'll be keeping you in the observation and uh, provide an appointment for a medicine for further management. Is my management plan okay with you? Mr. Karim, is my
Okay, thank
management plan
you.
okay?
Thank
Yeah.
you, Giovanna. Okay, you did well, but I have only one comment. Okay, what is the diagnosis here?
Most like upper GI bleed, sir.
Of course, it's upper GI bleed. This is not diagnosis. So the patient has any trauma?
No,
The patient is using any painkiller or he has any tummy pain?
no, sir.
So it's not ulcer, right? Any chest pain?
No.
So it's not food pipe. Easy.
Okay, sir.
If the patient has no chest pain, I will not think about food pipe. Clear now? Okay.
Okay.
I will not think about malware western. I did not say I have forceful vomiting. I did not say I have chest pain, so it's not food pipe. The patient has any blood disease?
No, sir.
It means it's not blood disease. Any blood thinning medication?
No.
Did I give you any clue?
Nothing from the history part, sir.
I am asking you, did I give you any clue? No.
No,
Say
no,
no.
sir.
So you can say, according to your data, there is no clear cause. Unlikely to be like that in the exam, but I try to test you, okay? So
Okay, sir.
you can say, according to your data, there is no clear cause at the moment. You are not using any blood thinning medication. You don't have any blood disease. You don't have any tummy pain. You are not using any alcohol. Did you get my point?
Yes, sir. Yes.
You have no
So
chest
there's
pain.
a
You
no
have
clear
no.
cause.
Yes.
Yes, sir.
You can think loudly in front of the examiner. Do you think mandatory to invent diagnosis? No. Invent a diagnosis without clue, not good. Clear?
Yeah, sir. Okay.
So you can say, according to your data, no clear cause at the moment. For this reason, I will keep you in observation. Do blah, 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 blah. Okay? Then,
Yes.
so inflammatory marker, infection screen, and the blood profile. and some specific blood test like hemoglobin by name, hemoglobin, urea. What else? Check your vital signs, give specific parameters, systolic blood pressure and heart rate. Easy.
So I need to specify some of the blood test and the
Because
vital
blood
signs.
Shepherd score.
Yes,
Do you
sir.
need to
Okay.
mention blood Shepherd score? No need. Once you say blood like hemoglobin, urea, vital signs like heart rate, systolic blood pressure, the examiner will understand you are talking about blood Shepherd score. Easy?
Yes, sir.
Okay. What else? Since you have bleeding per rectum or blood with stool, this means you need camera scan. Easy?
Yes, sir.
For this reason, I will move you now. If your vital signs are normal, I will move you now to gastroenterology team, and they will prepare for a camera scan for you within 24 hours. Easy? Okay.
Yes, sir.
So you did well. Accuracy, I think 100%. Skillfulness, you are fluent 100%. Efficiency, structure 100%. Supportiveness 100%. Safety, you need to optimize the diagnosis and the management plan. So 90%. I will give you 9 out of 10. Well done. Thank you.
Thank you, sir.
Next one, I think Basamat. Basamat. If Basamat not available, Nagla Faqi.
Yes, sir.
Yes. So how are you, Nagla?
Fine, alhamdulillah.
So this station the same as previous one, okay? So here, if the patient has trauma, injury, if the patient has blood disease, so this is the code. If the patient is using blood thinning medication, this is the code. If the patient, for example, not giving you any clue, but he said, for example, bleeding per rectum, and he has lumps in his body, he has constitutional symptom. What is the diagnosis?
Malignancy.
Malignancy. Easy?
Yes.
Okay. So if the patient said, I have pain, so he went to say malignancy, most likely painless. He has no tummy pain. He has no pain in anal area or in the tummy. Clear? If the patient said, I have pain and no constitutional symptoms, he has pain uh, when he's doing when he's passing stool. So what does it mean?
Anal fissure, maybe.
Yes, most likely anal fissure. Easy?
Yes.
Okay, so you have all the differential diagnosis. Don't think about the diagnosis now. Just focus on the general approach, and you find in the end the diagnosis is shining. Clear?
Yes.
Okay, you have 30 seconds and 6 minutes. The same management plan, same everything.
Okay. Good morning. I am Dr. Anigla. May I know your name and age, please?
I'm Karim. I'm 43 years.
Nice to meet you, Mr. Karim. How can I help you?
Yeah, I found some blood during passing stool.
Oh, sorry to hear that. Did you have bleeding right now?
No, no,
Okay. Are you comfortable?
it's okay.
Do you need any painkiller? Okay. Can you tell me more about your rectal bleeding?
Yeah, the problem started 1 week ago. Started
Mm.
gradual, increasing, worsening, and then so on and off.
Mm. Okay, you said the problem started 1 week ago and it is gradual and increasing and on and off. Am I right?
Yes.
Okay. Is it affecting your daily life?
No, no.
Okay. How often this bleeding happen?
Yeah, Like 1 time per day or 2 times per day, something like that.
Is it before or during or after defecation?
Sometimes during, sometimes after.
What's the color of the stool? Is it
Fresh blood.
fresh blood? Is it containing any clots?
No, no.
Do you know how much is it as a spoon or cup?
Like teaspoon.
Teaspoon. Is there any bleeding from any side of your body?
You mean apart from rectum?
Yes, other side.
No, no.
No. Is this problem happened before?
No.
Anything increase it or decrease it?
No, no.
No. Okay. Is it associated with tummy pain
No, no.
or pain in your rectum?
No.
No pain. Is there any trauma?
No, no.
No trauma. Is there any change in your bowel habit?
No.
Any change in your urine?
No, no.
Is there any change in your skin color or your eyes color?
No.
Okay. Is there any fever?
No.
Any change in your weight?
No.
Any change in your appetite?
No.
Any lump in your body?
No.
Any night sweat?
No.
Did you have any headache?
No.
Loss of consciousness?
No, no.
Any jerky movement?
No.
Any weakness?
No.
Any dizziness?
No.
Okay. Did you have any past medical history?
No.
Did you on any current medication?
No.
Is there any previous surgery?
No.
Did you have any allergy?
No.
Mr. Karim, I want to ask you a question I'm asking to all my patients. Where are you living and with whom?
My family downtown.
Did you smoke?
No.
Drink alcohol?
No.
Or by any chance using any illicit drugs?
No.
What do you do for a living?
I'm receptionist.
Okay. Did you want to add anything?
No.
What is your concern?
What is the problem, doctor? Is it serious? Do I need any admission, any surgery, any imaging?
Okay, according to your data, you have no pain during passing this blood stool, and you are not in any blood thinner medication, and there is no trauma. And till now, I didn't have clue, but I will examine you. I will put you in private area, and I will examine you with chaperone. Everything will be confidential, and you can stop me at any time. And I need to collect some blood tests, including full blood count, bleeding profile, and inflammatory marker. If I didn't found any clue, I can give you, I can refer you to the surgical doctor for more assessment. Is it right? Is
Thank
it
you.
nice?
Thank you. Your time done.
Okay.
Okay. I try to ignore everything, deny everything. Okay.
Mhm.
So I denied trauma, I denied constitutional symptoms, I denied blood thinning medication, denied blood disease, denied pain. So no clear cause at the moment, right?
Yes.
Okay. So you can say, according to your data, no clear cause at the moment. Then you can explain loudly. You don't have any blah 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 blah. For this reason, I will keep you in observation room to complete physical examination, do blah blah blah. So inflammatory marker, infection screen, blood profile, and you will do digital rectal examination as well, right?
Okay.
Okay. You will refer the patient. You will refer the patient to gastroenterology team.
Oh,
Okay.
that's not security.
Okay. So this patient, until now, no clear cause. You cannot discharge. Okay. If no clear
Yes.
cause, you cannot discharge now. Okay. So he needs further assessment and management. Okay.
Management. Okay.
I will give you a 10 out of 10. Well done. Thank you.
Okay.
Next one, Kalyan.
Hello, sir.
How are you?
I'm good, sir.
Okay. Next station, hematuria. So the patient has blood in urine. So if the patient has pain with urination, what is the diagnosis?
Uh, could be in infection, tummy pain, sir. You mean?
Stones.
Okay, sir. Okay.
Patient has burning in micturition or he has tummy pain. So think about stones. Easy.
Okay, sir.
So bleeding with tummy pain in urine. So stones until proven otherwise. Okay.
Okay.
If the patient is using blood thinning medication, this is the reason. If the patient has blood disease, this is the reason. If the patient has trauma, what is the cause?
Trauma.
Injury. Okay.
Injury.
So if the patient denied everything and no pain, what is the diagnosis until proven otherwise?
No pain.
Malignancy.
Malignancy.
Malignancy. Easy.
Okay, sir.
But of course, if they will give you malignancy, they will add constitutional symptoms, right?
Okay, sir. Yes.
Okay. So I think you can follow the general approach and then you will find the diagnosis very clear to you. Okay.
Okay, sir.
You have 30 seconds and 6 minutes.
Can I start, sir?
Okay.
Hello, I'm Dr. Kalyan, ED Registrar. May I know your name and age, please?
Karim, 43.
Nice to meet you, Karim. How can I help you?
Yeah, I noticed blood in micturition, doctor.
I'm sorry to hear that. Are you comfortable now? Do you have any pain? Do you have any pain?
No, I'm okay now.
I need to take some data from you regarding your problem. Is that okay with you?
Yes.
Can you tell me more about your problem?
The problem started 1 week ago, started gradual, increasing, worsening.
So you said the problem started 1 week ago. It is gradual and it's increasing and worsening. Is that right?
Yes.
Have you had this problem before?
No.
Is it affecting your daily life?
No.
Anything cause or worsen it?
No.
Anything improves it?
No.
Do you have any pain while passing urine?
No.
Mm, any bleeding from any other orifice?
No.
What is the quantity of the blood? Can you tell me? Yeah. Any change in urine color? Any change in frequency?
No.
Any urethral discharge?
No.
Any skin changes or ulcer in your genital area?
No.
Any tummy pain?
No.
Any change in bowel movement?
No.
Any do you feel sick?
No.
Did you throw up?
No.
Did you throw up?
No.
Any yellow color of skin or eyes?
No.
Any headache?
No.
Any loss of consciousness?
No.
Any vision problem?
No.
Any numbness in your body?
No.
Any weakness?
No.
Any trauma?
No.
Any chest pain?
No.
Any heart racing?
No.
Any dizziness?
No.
Any shortness of breath?
No.
Any cough?
No.
Any noisy breathing?
No.
Any skin changes in your body?
No.
Any high temperature?
No.
Any night sweats?
No.
Any change in weight or appetite?
Yeah, I lost appetite.
Since how long?
Yeah, for 2 months I lost appetite, and I think I lost weight also because my clothes I think um wide now. Yeah, loose.
Okay, I'm sorry to hear. I'm sorry to hear that. Any lump in your body?
I think yes, in the groin.
Since how long you are having this lump?
I noticed within 3 weeks, something like that.
Okay, I'm sorry to hear that. Any previous medical disease?
No.
Any previous surgery?
No. No.
Any prescribed medicine?
No.
Any allergy?
No.
Any disease run in your family?
No.
Where do you live and whom do you live with?
With my family in downtown.
What do you do for living? Do you smoke? Do you drink alcohol?
No. No.
Or by any chance, do you use any illicit drugs?
No.
Would you like to add anything regarding your problem?
No, doctor.
May I know what is your concern?
Is it serious, doctor?
I appreciate your concern. Actually, according to the data, you are having blood in your urine for the past 1 week. It is worsening and it is gradual in also. And you also lost weight and you also have lump in your body. So I think I'm sorry to say that it is serious. I think it is malignancy in related to your kidney, urine, or bladder or prostate. So to confirm this diagnosis and to rule out this, I need to keep you in observation room, check your vital signs, do complete physical examination from head to toe, including your tummy, kidneys, bladder, ureter, prostate, and then do some blood tests, including inflammatory markers, infection screen, full blood count, blood profile, blood grouping, saving, and urine test. And I'll do imaging like tummy scan. Then if everything is if any abnormality present in this blood test or tummy scan or examination, I will admit you under urologist. If
Okay,
everything is
thank you. Thank you, Kyle.
Okay, sir.
Your time done
Okay, sir.
30 seconds ago. Okay,
Okay,
so
sir.
this patient, I denied trauma, I denied blood disease, I denied blood cell medication. I gave you clue for constitutional symptoms and no tummy pain, no burning and micturition, right?
Yes, sir.
Also, no change in urine. I mean, no burning micturition, no change in frequency, no dark urine. Okay. Someone will
Yes, sir.
think how you are asking about the change in urine and he already has blood. This blood is not continuous, right? So
Yes, sir.
if the patient has blood on and off, it means sometimes the urine is clear, right?
Yes, sir.
Okay. So when you ask in the beginning, is this blood before, during, or after the urine? This is also important, right?
Yes, sir.
And the continuous or on and off, this is important. If continuous,
Okay.
for sure, it will change the color of the urine. Clear?
Yes, sir.
Okay. So if the patient has no change in urine, it's not UTI or not stones. Clear now?
Yes, sir.
If the patient has dark urine and he has frequency in urination, I mean, burning micturition, here you should think about KUB system, maybe stones or infection. Anyway, the patient has constitutional symptoms, um, whatever loss of weight, also lumps in his body, and maybe night sweats, maybe temperature. So think about malignancy until proven otherwise. Okay, well done. So what you will do, same general management plan, observation, complete physical examination, head to toe. You will do also examination of the tummy, kidney, ureter, bladder system. You will do imaging also, right?
Yes, sir.
Which imaging?
Tummy scan for KB and prostate.
So you will do tummy scan, ultrasound scan, right?
Yes, sir. Yes, sir. Ultrasound.
Because the patient has no tummy stones. If the patient said, I have tummy pain, what is the imaging here?
CT scan.
CT scan, KUB, easy,
KOB. Yes, sir.
without contrast. Again,
Yes, sir.
if the patient has tummy pain, so it could be renal colic, easy.
Yes, sir.
Then you will do CT scan, KUB without contrast. If the patient has no tummy pain, no burning micturition, so it could be malignancy. Here you can do ultrasound scan. What if you want to add CT scan, KUB? No problem. Easy?
Yes, sir.
Okay. But it will be secondary to tummy scan. Okay.
Okay.
Regarding the blood test, of course, some blood tests including inflammatory markers, infection screen, blood group, cross match. Um, you will do also kidney function tests and urine test. Easy?
Yes. Okay.
Okay. If you find um, all are normal um, except the blood in the urine. So it could be malignancy. For this reason, I will refer you. If you want to say refer you to urologist, or if you want to say refer you to oncologist, okay. If you want to say I will discharge you, if you find all normal, discharge you and give you printed leaflet discharge letter to your GP, and I will arrange appointment with oncologist, no problem. The most important, make your decision reasonable, easy.
Okay, sir.
For example, if don't say discharge until you proceed it with everything normal. Clear?
Clear, sir.
Then, for example, if you say if you find any problem in the blood profile, then we can refer you to a blood doctor. So we can correct that and refer you to blood doctor. Anyway, the most likely problem here, it will be malignancy. So the urologist here will not do anything for him. He will refer him also to oncologists, right? Okay.
Yes, sir.
I will give you 9 out of 10. Well done. Thank you.
Thank you, sir.
Next one, the last station. Who is happy to do this station? Vaginal bleeding. Anyone did not practice and is happy to practice this station? Or anyone practiced and is happy to practice this station?
Dr. Hani, yes, I can do.
I will do.
Okay, Ali.
Yes,
Okay, if the age is 65, think about
yes,
maybe postmenopausal bleeding, maybe blood thinning medication, maybe blood disease. Easy.
yes,
If the age is young, like for example 25, 30, something like that, maybe vaginal tear. Clear?
yes.
How to know?
Or
How to know vaginal
um,
tear?
if the
Um,
from the
on,
history from yes.
on. So, for
Okay,
example, she said the problem started 1 hour ago, the bleeding started 1 hour ago, and if you ask anything cause or worsen it, she will say this happened after sexual act. For sure, it's a vaginal tear or anything like that.
okay,
But in postmenopausal, she will say, I have a spotting maybe 3 weeks ago, started gradual, worsening, on and off, easy.
yes.
Okay. But regarding the sexual act, she will say continuous. So started 1 hour ago and continuous, even if mild. For example, if you say, is it like teaspoon or cup, maybe she will say like teaspoon, but continuous.
Continuous, yes.
Clear now?
Yeah. Okay, doctor. From the beginning, I will transfer the patient to the RR.
Any bleeding, move to
Yes.
observation room.
Observation.
If you want
Okay.
to say resuscitation, it's okay. But
Okay.
here, move to the observation room. Are you comfortable? Do you still have bleeding now? Like that. Easy?
Okay. With a chaperone and private room.
Yes, private room and with a chaperone. Okay.
Okay.
So here you don't need to ask a sexual history. You don't need to ask a sexual history. Even if the patient, for example, she said this happened after sexual act, also no need to ask about sexual history. But if you
Okay.
ask here, for example, if she said this happened after sexual act, and for example, the sexual act was 5 days ago, and she has urethral discharge and blah blah. Here you can ask about sexual history. Easy,
Okay. Yes.
but
Okay.
unlikely to be like that in the examination.
Okay.
You have 30 seconds and 6 minutes. What if you find the patient has no clue in the data? So it could be postmenopausal bleeding, so you should rule out malignancy. Even if she doesn't have any constitutional symptoms. For example,
No.
she said, I have this bleeding and the last menstrual period. Of course, the most relevant system is menstrual,
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 genitourinary, and
GIT.
GIT.
Yes, and
Yes.
then other system. I mean, if the patient said last menstrual period at 50 and first menarche or first period 14, for example, it was a regular period anyway, and she denied constitutional symptoms. You don't rule out malignancy. Okay.
Yes.
So,
Okay.
what if you find the patient give you these symptoms and she said, I'm using aspirin, for example.
So
So
it could be
you have clear
yes.
cause, aspirin, blood thinning medication, and you need to rule out malignancy as well, right?
Yes, right.
You should mention that to the actor to show the examiner, okay?
Okay.
When you mention malignancy, you can say, I'm sorry, we need to rule out serious problem like malignancy. When you say malignancy, you can be slow and low. Easy?
Yes. Okay,
Okay.
sir.
You have 30 seconds and 6 minutes.
Okay. Hello, I'm Dr. Ali, the registrar. May I know your name and age, please? Nice to meet you, Mr. Karima. How can I help you today?
Yeah, I have vaginal bleeding, doctor.
I'm sorry to hear that. Are you comfortable? Do you have any pain?
No, it's okay now.
Okay. Do you still have bleeding now?
It's okay. I have, but it's okay. I can control.
Thank, thank you for that. I need to transfer you to a private room. A nurse will be with us as a chaperone, and anything you will tell me, it will be confidential, and you can stop me at any time. Is that clear for you?
Yeah.
Okay, thank you. Can you tell me more about your vaginal bleeding?
The problem started 10 days ago, started spotting, and started gradual increasing, worsening, and I think it's on and off.
Okay, thank you for that. You told me started 10 days ago, worsening, increasing, like a spotting before, and is on and off. Am I right?
Yes.
Okay, thank you. Does it affect your daily activity?
No, no.
Okay. Is this first time?
Yes.
Okay. And you told me it's worsening and on and off. Is that right?
Yes.
Okay, thank you. You told me it's like a spot. Can you estimate the amount, like a teaspoon or cup?
Like teaspoon.
Okay, thank you. How many bats did you change it?
Actually, in the first day, I was not using any bat, but
Okay.
the last 3 days, I'm using one bat.
Okay, thank you for that. Can you describe me the color of the blood? Is fresh or dark?
Fresh.
Any clot with it?
No, no,
Okay. Any bleeding from other orifice?
no.
Okay, thank you. Anything make it worse?
I don't know, but I'm using blood thinning medication like 1 month. I don't know if this is the reason or not.
Thank you for that. Can you remember the name of it, please?
Aspirin, something like that.
Okay, thank you for that. Anything make it better?
No,
Thank you for that. Can you remember when your last menstrual period?
I was 50, so I think 15 years ago.
Okay. Okay. Thank you. When was the first period?
I was 15.
Okay. Thank you. Is it was regular or irregular?
It was normal.
Okay. Thank you. Is there any urethral discharge or any
No,
ulcers in? Okay. Thank you. Is there any problem in the urine, like change in the color or dysuria?
no, no,
Any tummy pain?
no, no,
Did you throw up?
no,
Do you feel sick?
no,
Any change in the discoloration, yellow discoloration of your eyes and skin?
no, no,
Any change in your bowel habit?
no,
Any bleeding in your stool?
no,
Okay, thank you. Do you have any chest pain?
no,
Any heart racing?
no, no,
Any dizziness?
no,
Any cough?
no,
Any shortness of breath?
no,
Any noisy breathing?
no,
Any headache?
no,
Any jerky movement?
no,
Any loss of consciousness?
no, no,
Any vision problem?
no,
Any trauma?
no,
Any weakness or numbness?
no,
Any high temperature?
no,
Any night sweats?
no,
Any lump in your body?
no, no,
Any loss of appetite or weight?
no,
Thank you. Do you have any past medical disease?
no,
Any previous surgery?
no, no.
Any prescribed medicine?
Yeah, I'm using
Sorry
this
for that. You told me you
aspirin.
have. Yes, thank you for that, for clarification. Any allergy?
No,
Any disease running in your family?
no.
Where you are living and with whom you are living?
With my husband in downtown.
Okay. What you are doing for a living?
I'm retired.
Okay. Do you smoke?
No, no,
Drink alcohol?
no,
By any chance you are using illicit drugs?
no,
Would you like to add anything?
no.
What is your concern, Mrs. Karima?
So, what is the problem, doctor?
I appreciate your concern. According to your data, you told me you are using aspirin, and this bleeding started 10 days ago. It could be due aspirin, but at your age, 65 years, we have to rule out. I'm sorry to tell you like that. We have to rule out serious condition, for example, like malignancy. I'm sorry to tell you that. For this reason, I will keep you in observation room. I will check your vital signs. We will do a complete examination from head to toe, including your tummy and your genital area, and also I will do blood test, including hematology, chemistry, and blood group cross-matching and blood group profile. Also, I need to do ultrasound for your tummy. Also through your vagina. Also, we can use. I will use also speculum. It's device called speculum to examine your vagina. Okay, and according to the investigation, if all abnormal, anything abnormal, I will refer you for gynecology. Or otherwise, if all normal, I will discharge you with GB with the letter and printed leaflet and appointment in gyne OPD. Is that clear for you?
Okay, thank you. Your
Thank you.
time almost done. Thank you.
Thank you, sir.
Okay, well done. So here you will do, you mentioned everything. So I will focus only on the ultrasound scan. You will do ultrasound scan through the vagina and through the tummy as well. Why through the vagina? To check the womb thickness.
Yes.
Clear? I want you to
Yes.
emphasize on that, to check the womb wall thickness.
Okay.
Because if the wall thickness more than 5 mm, it's malignancy. Clear?
Yes, clear, sir.
Okay, well done. So here regarding this station, if the patient has no worrying symptoms, like this patient, she did not mention any worrying symptoms, right?
Yes.
So if the problem not malignancy, so you can say if we found the womb wall thickness less than 5 mm, it means it's not malignancy. And for this reason, we can discharge you with printed leaflet, discharge letter to your GP, and advise you to stop the aspirin and review with your physician. Clear?
Yes, sir. No need for gynae like that. Can gynae OPD?
Because she doesn't have any problem. So you can tell her, you already give her two possibilities. So if you find the tummy ultrasound scan womb wall thickness less than 5 mm, so unlikely to be malignancy. It could be because of the aspirin, the blood thinning medication. If we find all blood results normal and all examination normal, so it's safe to discharge you with printed leaflet, including stop the aspirin and discharge letter to your GP, and you can review with your treating physician. Easy?
Yes, easy, sir.
Then, if you want, if you still have time, if you want to give her additional possibility, you can say, for example, if you find any problem in examination, in the blood results, in the tummy ultrasound scan, I can refer you to the doctor of gynae now. Clear?
Okay. Yes, clear, sir.
Okay. Well done. I will give you 9 out of 10. Well done. This is the last station. Uh, you are doing well, guys. Inshallah, the next decision will be on Monday. It will be 4 p.m. UK time as usual. What is the next station? Next decision, sorry.
How approach?
Who approach. So history taking, who approach, and the next one will be pediatric. Then we can jump to psychiatry. Thank you, guys, and bye bye.
Thank you, sir. Thank you so much.
Bye bye.
Bye.
Thank you very much.